Assalamu alaikum. Now I would like to talk on syringomyelia. This is cystic degeneration of the spinal cord. What happens in here? This is anterior commissure. This is anterior commissure. This is anterior horn. This is lateral horn. This is anterior horn. This is lateral horn. This is anterior commissure, and we know that pain temperature pathway actually decussates here. Both sides of the pain and temperature pathway actually decussates here. If there is cystic dilatation in here, it causes a loss of pain and temperature. It causes a loss of pain and temperature it may be due to trauma or with Arnold Chiari malformation. It usually occurs at C8 to T1 level. Presents as sensory loss of pain and temperature and sparing the fine touch and pressure sense. Why? This is the dorsal column. Spinal cord is intact. But anterior commissure is involved. Where we know that anterior spinal thalamic tract causes pain, temperature, and dorsal column causes fine touch, proprioception, 2-point discrimination. These are the features found in dorsal column. In anterior column, anterior spinal thalamic tract, there is pain and temperature. If it involves anterior horn, then what happens? There is lower motor neuron type of features. Lower motor neuron type lesion. There may be features of lower motor neuron type of lesion. So, because we know that in lower motor neuron starts with anterior horn cell of the spinal cord. Lower motor neuron usually starts with lower motor neuron lesion usually starts with anterior horn. If there is damage to the lower motor neuron, it causes muscle atrophy. And muscle atrophy, weakness, and delayed muscle tone and impaired reflexes. If it involves a lateral horn, that may lead to development of Horner syndrome. In Horner syndrome, we know that features are PEAM, ptosis, enophthalmos, and hydrosis, meiosis. Ptosis, enophthalmos, and hydrosis, and meiosis. These are the features found in syringomyelia. Now, next disease, poliomyelitis. In poliomyelitis and in Waardenburg-Hoffmann syndrome, in both cases, I can make you answer that in both cases there is destruction or loss of anterior horn. If you destroy the anterior horn, that means this place. If you destroy the anterior horn, then it will surely cause lower motor neuron lesion, lower motor neuron type of paralysis, and the features of the lower motor neuron type of paralysis. That means flaccid type of paralysis. That means muscle atrophy, muscle weakness, decreased muscle tone, impaired reflexes, and negative Babinski sign. That means downgoing to. In Waardenburg-Hoffmann syndrome, there is also anterior motor horn destroyed. It is autosomal recessive, but it presents as a floppy baby, and death occurs within a few years after birth. But in amyotrophic lateral sclerosis, what happens in the amyotrophic lateral sclerosis, there is both upper and lower motor type of lesion. In amyotrophic lateral sclerosis, you may get the features of the upper motor neuron type of lesion, you may get the features of lower motor neuron type of lesion. In here, there is anterior motor horn degeneration leads to lower motor neuron types of lesion, such as muscle weakness, downgoing toes, impaired reflexes, negative Babinski sign, and there is lateral corticospinal tract degeneration. Lateral corticospinal tract degeneration causing upper motor neuron type of lesion like hyperreflexia, increased muscle tone, and positive Babinski sign. There is atrophy and weakness of hands in early and atrophy and weakness in early and lack of sensory impairment distinguish the ALS from the syringomyelia. In lack of sensory impairment distinguish ALS from syringomyelia, and most cases are sporadic and arising in the middle-aged adult. There is zinc copper superoxide dismutase mutation. Zinc copper superoxide dismutase mutation. We know that oxygen is converted into free radical. Oxygen is converted into superoxide, and this superoxide is converted into hydrogen peroxide with the help of superoxide dismutase. If you don't have this superoxide dismutase, it may injure your nerve and causes radical injury in the neuron. Okay, next. Now FA, that means Friedreich ataxia. What happens in Friedreich ataxia? We know that there is a degenerative disorder of the cerebellum. There is degenerative disorder of the cerebellum. There is degenerative disorder of the cerebellum and the spinal cord. There is degenerative disorder of cerebellum and the spinal cord. And in Friedreich ataxia, you have to know that GAA, gait ataxia, there is trinucleated repeat expansion. It's an autosomal recessive trinucleated repeat expansion, GAA, and there is GAA in the frataxin gene. GAA in the frataxin gene. GAA in the frataxin gene. Loss results in iron buildup with free radical damage. Presence with early childhood. Patient are wheelchair bound within a few years, and associated with hypertrophic cardiomyopathy. Okay, and that's all for today.